Hello.
Hey Cody.
Let me get this going really quick.
Hey Cody, this is Christy. Hi. For some
Hi,
reason, I
Christy.
think because I logged in first, I ended up being the host, but I actually have to jump at 2:30. So I
Yeah, feel free
just
to make me the host.
okay, just want to make sure you saw that. So when I leave, the whole thing doesn't fall apart.
No problem. Normally, I am not on screen share duties, but I will be today. So give me a second. Hoping that works while we wait for quorum. All right. Andrew, Jackie, I can take the lead on a few of these. We should have some guests here. I do see pages here. It's about percent. But it's hard for me to host plus put the agenda up. So I will start with our group agreements and go from there. If folks can put name and role and pronoun series in the chat, that would be great. I know we have some new folks today, so welcome to them. And some of our data and evaluation mini group agreements are to be present, participate to the best of your ability, treat others with respect, avoid interrupting and use the name pronouns they prefer, avoid acronyms, use the chat to write definitions or ask for clarification. Varied and opposing ideas are welcome. Be curious when disagreement occurs. Honor those with quieter voices. Lean in or lean back. Avoid problem solving for situations. Act not finding possible. Focus on our purpose, improving the system of care for Oregon. Be mindful of the power dynamics in the room, and do your best to avoid harming others. And be open to repairing harm you may cause. All right, Andrew, Jackie, do you mind checking to see if we have quorum, and then I can introduce our guest today.
Yeah, I can get us started. Um, David or two, you on here? Adam Rodakowski.
Adam is excused.
Chris, I think I saw you. Barnes. Yes. Amber Kramer? Bonnie Kraxberger. I don't know if I said that right.
You did. Nice job.
Oh, thank you. Brianna Neely.
I'm
Will.
here.
Oh, great. Will Burchard. I feel like this is a mean role to take on.
We got to read a bunch of last names today.
First names only. Hillary Harrison.
I'm here. Hopefully that one was easy.
Yeah, Chris Kuhn. Piper Block.
Piper's excused.
All right, Samantha Kahn. Close. Jen Corbridge. Alyssa Cox. Mark Hammond.
Here.
Great. Thanks, Mark. Isabella Jacoby. I saw your name in the chat, but you're with us.
Yes, I'm here.
Great. Mark Greenwald.
I'm here.
Awesome. Steve Westberg. Marg. I'm not sure how to say his name. I really
It's Margot.
apologize. Margot Cameron. Thank you, Cody. Becky Marshall.
Becky's excused.
Gretchen Morley.
Here.
Great. And then we still have some open seats. So thanks everyone.
Open seats that we are working to fill. All right. Let me get the agenda pulled up very quickly so that folks don't have to.
Sorry to interrupt, but
You
I know
might-
you just marked, and I'm going to say her name wrong, Alicia Cox. Absent,
Oh.
but she showed up after.
Oh, perfect.
I see.
Yeah, sorry, I had some technical difficulties. Good afternoon, and you did pronounce it correctly, Alicia Cox. She,
Hey.
her pronouns.
Thanks for being here.
Nice
Oh, and
work.
Mark Hammond, you must have popped in later. Okay,
He-
Cody's got it.
Yeah, Mark said he was here.
Oh, my bad. Okay.
All right, and then I will give our guest today a quick introduction. She's a research analyst. That would be Paige Snow, who's here to present to us today on early and periodic screening, diagnostic, and treatment. Paige, can you give us a little bit more context for today? But we're excited to have her here and get some feedback from everybody in this room on where we're headed.
Hi, everyone. Yeah, so happy to be here. Paige Snow, she, her pronouns. I'm the Medicaid Child and Youth Research Analyst at the Oregon Health Authority. Yeah, and I'm here today to talk to you about a report that I am working on. It's a legislative report, and it's due at the end of this year. And the focus of the report is on children who are enrolled in Medicaid. So just trying to do some engagement this year with a bunch of different like councils, committees, forums, and different spaces where I can bring this report and, get some feedback before it goes out to the public. I see many familiar faces here, which is great. And some of you may have already heard this presentation. Hillary, maybe you've seen it like 3 times now. So, yeah, happy to share more. And I have a couple folks from our team here. Nick Stroud is the operation and policy analyst for the early and periodic screening, diagnostic, and treatment program. Vesna is also on our team and helps us with the Medicaid Management Information System. And then Natasha's here from my Health Policy and Analytics team. She's going to help me with note-taking and feedback and all sorts of things. So happy to be here and share more with you today.
Can I just add a couple comments, Paige, before you dig in?
Yeah.
One of the things I think is important for everyone to keep in mind as Paige goes through the presentation is how does this relate to our strategic plan? How does this relate to the work of this committee? And so just to kind of connect some dots, Cody and Jackie and I were all talking about this. Just to be very clear, our top goal, I mean, I know they're not in priority order, but of our strategic plan is about improving access to coordinated and integrated community-based services. EPSDT, as you'll hear a lot about, is written into our Medicaid waiver, and it will as we'll be going through this, we'll learn more and more about who's eligible for what. Because one of the things that I think is confusing for families, for youth, for whatever is, what am I eligible for? And this is going to be specifically within the Medicaid system. If a youth or a family is commercially insured, this may or may not be quite as relevant, but we've got a lot of young people in the Medicaid system that this will be relevant for. So just want to make sure to connect those dots about how it's relevant to our strategic plan and our work here in this committee.
Thank you, Andrew. Paige, do you have screen share permission? If not, I can make you co-host. I want to get ahead of that before I have to do that.
If I have, oh, I do. I think I do. Let me see.
Perfect. Paige, I will leave it to you. Feel free to jump in.
Okay. Hopefully, hoping you can see the presentation and
Yes, we
presentation
can.
mode? Perfect. Okay, and I'm gonna adjust my gallery so I can still see you all. Okay, I'm not seeing the chat, so please let me know if there's a chat thing.
I'll
Great.
monitor the chat for you, Paige.
Okay, thank you so much. Awesome. So yeah, I first I'll kind of talk about the background of the legislative report, and I shared a little bit about me, and I have some of that information in the purple box to the right. So again, I am a research analyst at OHA, and I sit in both the Health Policy and Analytics Division, which is like same division as Cody, focused on the data side of things. And I'm also matrixed to the early and periodic screening, diagnostic, and treatment team within Medicaid. And so trying to be helpful on both sides and be more integrated into, Medicaid operations and things like that. So that's sort of a unique thing about my role. And I'm bringing this report here today, mostly, wanting to get feedback from, this committee on any of the SOCAC content. So I have a couple slides related to SOCAC. Again, going back to what Andrew said, just trying to like make a stronger connection between EPSDT and SOCAC. I know that EPSDT was in a little bit in the data report, so just happy to connect our team with this committee, so we can think about how to work together moving forward, or stay aware of what we're all doing. In terms of the legislative report, really looking for any feedback, but big picture feedback, like, is there something missing that you want to know? When we go over the SOCAC slides, am I sharing it the way that it sounds right to you, or is there something more that you want to say about SOCAC that's missing? And any feedback on making the report more approachable for youth and families. So this is, a legislative report. It's mandated in statute, but if a family happens to come upon the report, I want it to be interesting and like approachable, maybe spark some curiosity. So happy to take any feedback on that. And then, yeah, as I said, just hoping to, collaborate across the system and, strengthen any analysis or shared learning as we move forward. And this legislative report, this is the first one, so we're really thinking about it as a baseline report. And trying to just share, like, what do we know? And I think, the data report that you all have is super, super, super comprehensive and detailed. And this report is not going to be the same or fill the same sort of role, but just hoping to elevate some of the policies and things that we're trying to do in the early and periodic screening, diagnostic, and treatment program. Based on statute, the report is really based on, people who are under age 21 and who are enrolled in the Oregon Health Plan. So, if you fit that, you are eligible for EPSDT. You are an EPSDT beneficiary. There's nothing extra that you need to do. It's just that is the program that is Medicaid's comprehensive benefit. For the report, we're trying to, look across systems and identify broad needs without going into like a ton of detail. So really taking a wide view instead of a deep dive into anything. Per statute, the report is supposed to center equity, access, and quality of health outcomes. So any comments to support equity in this report, that would be greatly appreciated as well. So hoping that it will generally describe the population, the EPSDT population, or children, youth, and young adults under age 21 enrolled in Medicaid, their benefit, their care experiences, and hopefully help guide policy and program strategies. So I have the state law and the Senate bill linked here if that's something that you're interested in. Yeah. So we have drafted about half of the report, and we have some major sections. So first is kind of like I've been thinking about the report as an interactive dashboard potentially, or maybe a series of web pages. But basically, the first section would be sort of like a home landing page, sort of executive summary style. So welcoming the reader in, a background, key findings, guidance, and limitations and next step, and maybe describe some of the equity processes that we took. A section for Oregon Health Plan members, so highlighting the program and their benefits, member rights, and how to get help. We'll have a section about OHP members, so really describing that population of children and youth under age 21 and enrolled, looking at enrollment over time, demographics, and some equity groups that we've named related to EPSDT guidance. Next section would be the systems view. So this is really where we would, share about SOCAC and link out to different SOCAC resources. And this is where we will also feature OKID. I know Gretchen's heard a version of this presentation already. Hoping to also have, a one-pager about schools, like how Medicaid and schools interface or work together, and we'll get that reviewed through our Medicaid program related to schools. And then we have a one-pager about CCO partnerships related to the Community Health Improvement Plan. Later, we might add more about providers or other things. So, but right now that's sort of the systems view. The last major section, yeah.
Sorry to interrupt. Looks like Alicia has to hop and she's wondering when you need feedback by. Can we just let her know that before she has to pop out?
Sure, yeah. Honestly, in the next couple weeks, in the next month, the report has to be final draft by October.
Awesome. Thank you so
Thank
much.
you so much.
Member outcomes, so focusing on member voices, specifically from our ombuds data, and we'll also be looking at, the CMS Child Core Set and CCO quality metrics. And eventually we'd like to have a data directory. So there will be a lot of resources in this report, but having like a table or some sort of directory where folks can access reports on this population from across OHA, but also outside of OHA and maybe national data sets. So just, a place to kind of centralize all the links if you wanted to browse around on children, youth, and young adult data. Okay, with that, that's all the background I have so far. I just want to check to see if there are any questions before I continue on. Okay.
No questions in the chat yet, Paige.
Thank you. Okay, so as I mentioned, we're sort of thinking about this. There are a lot of elements to this report where there's like kind of a lot of data, and putting that all in a PDF, could be difficult, or putting some of it in. So we're trying to think, could this report be an interactive dashboard report? Would it be better as a PDF? Is there maybe another format? I think a lot of the feedback we've gotten so far is that people like the interactive dashboards, but I know that for some folks they can be a little bit intimidating. So just thinking about what it could be like if it was a report. I have like the major sections up along the top and subsections along the right. And so just thinking of each topic as like a one-pager linking out to other like main reports in other places. So we'd have like a one-pager for SOCAC and it links out to SOCAC resources. And really hoping that when someone lands on the report, we'll have like a cool infographic or something like showing sort of what the report's about, giving that background on the report, and having something there that sort of welcomes someone in rather than like a dry, like this is for Oregon statute number whatever. Just trying to think of something that's a little bit more inviting. And so the next big section that we have is like for Oregon Health Plan members. And so really what we wanted to do is just tell people that the early and periodic screening, diagnostic, and treatment benefit is Medicaid's comprehensive children's benefit. So, telling people about the program, and then we'd have, links along the bottom or somewhere on the page to link folks back to the EPSDT program page. When this launches, we'll have a children, youth, and young adults data webpage on the website. And so, linking back to the program so that people can get more resources, because we have a ton of really great resources on our website and no reason to reiterate it here. So trying to kind of keep the text low. Ideally, this will be in plain language. We have a lot of review in the future for plain language, so I've done my best, but we'll do a further review for that. And then
Oh, I'm sorry. I thought
folks
you were.
over to the, yeah.
I was just gonna draw a sharper point on this page here.
Yeah.
Because what this really spells out is if you're a kid on the Oregon Health Plan, 21, under the age of 21, you have a right to all 5 of these things. Now, that doesn't mean that someone's going to call you up and say, hey, it's time for your periodic screening. But if you are talking, to a parent of a child who is on the Oregon Health Plan and they're like, I don't know, how do I get X, Y, and Z? It's really important to kind of keep in mind that you have a right to these things. You may have to, kind of really reach out there and get it. But people can't come back to you and say, no, we're not going to do that for you.
Yes. Yes, hopefully that's sort of what we're going for, is like making sure people know they have this benefit. I think the treatment part is very misunderstood, especially because of the history of the early and periodic screening, diagnostic, and treatment program in Oregon. EPSDT really started in Oregon in 2023. Before that, the program was waived. So this program is federally has been around since like 1967 or something like that. But in Oregon, we've just waived it until 2023. And so in 2023, we finally said, yes, we are going to implement the EPSDT program in Oregon after, I don't know, 40, what's the math there? Like 50 years of not being implemented in Oregon. So this idea is very new to providers, to, folks in the healthcare system still don't know about EPSDT. So that's sort of the other purpose here, is just trying to get the program some visibility in this report, and trying to do so just in plain language. Cody, I see your hand.
Thanks, Paige. When I'm thinking about this data report, do you imagine this being like the data updating annually, or not at all, or shorter than annually? Because that kind of goes into my thinking of whether a PDF or the interactive dashboard is better.
Yeah, that's a really great question. I think if we did a PDF, we'd eventually have to publish dashboards, but they just don't come out at the same time. We are, the reports required every 2 years, but we are envisioning that the dashboards could be updated more frequently. I have the enrollment at an annual enrollment, so I think probably updating annually would make the most sense. But we'll kind of have to see like what the appetite is for, updated data once it gets out. But I think, ideally we would have a dashboard to start with, But if not, it would end up eventually if we started with just a PDF, I think. There is a ton of data, so I'm having a hard time imagining how I'm going to get it into a PDF, if that makes sense.
That's okay. I'm also thinking like as this becomes available, if it fits into our group in any kind of measures update, if we want to use metrics from this as some potential indicators for how the system's functioning for our youth in the future. Obviously,
Yeah.
we have our measures set up already, but just thoughts that are moving around.
I love that thought. I mean, so right now we don't really have any EPSDT measures. I mean, we do, but they're not like public or anything. The first report will really focus on measures that are already public that we know, so like the CCO quality metrics. But I do think that this is a great opportunity if there was a specific EPSDT measure that's really important to SOCAC, and it's also really important to our program, we could certainly create an EPSDT measure and put it in this report and keep it updated annually to track outcomes. I think that would be really cool. So definitely something to consider in the future for sure. Okay, I'm going to keep us moving. So for the next slide, I've also pulled in, different programs or organ health plan programs that members might want to go check out or navigate to. So, we have the organ health plan, the EPSDT program. I've also linked the school-based health services program, the young adults with special healthcare needs. We also have the reentry healthcare benefit for previously incarcerated youth. So just trying to, if there's a member here looking and they want to learn more about any of these programs or benefits, that would be available to them. And I'm happy to add more if anyone thinks like, oh, this one should be added. Like, I would love to add more to this list. I think going back to, Andrew, your comment earlier about member rights, that is one thing that we talk about a lot on the EPSDT team. How do we inform members of their rights? How do we inform providers of member rights? And these things kind of get buried in handbooks and guidance materials. And so just wanting to bring member rights up to the forefront in this for members section. So, the benefit of EPSDT is that any children, youth, or young adults under age 21 should get medically necessary or medically appropriate care. And that is specific to that person's individual needs. It's supposed to be, person-centered. It's not supposed to be based off where the service is on the prioritized list. And so in Oregon, I feel like what we've sort of heard is providers are aware of the prioritized list, but they're not yet quite aware that the prioritized list doesn't apply to children, youth, and young adults who have the EPSDT benefit. And so, for example, if someone gets a service and it is below the line on the prioritized list and they're under 21, that should be reviewed for medical necessity and medical appropriateness before it is denied. So, trying to communicate that is not always the easiest thing, but that's what we want people to know. We want folks to be getting denial letters when appropriate. We want providers to know that the prioritized list doesn't apply. If someone gets a denial, they should appeal. Often a lot of the appeals get overturned. So just trying to share EPSDT rights with members in this report. And then the last section that we have for members is just how to get help. I pulled a bunch of different links from across the Medicaid, the OHA Medicaid website of how to get help, talking to your CCO, calling in to OpenCard, how to get to the Ombud site, arranging an interpreter. So just trying to think of like what links might be helpful to members. And I've also included some common examples of like issues or concerns that get brought up when people do call in, and things that we do hear about from the Ombuds program or from the member services program. So just giving someone some sort of indication of why they might call in for help. All right. With that, I'll check to see if there are any questions. Otherwise, I can move on to the About OHP Members section. Okay. So yeah, we will look at OHP enrollment over time for people under age 21. And so we do get some questions about this, often related to continuous eligibility, especially for kids like 0 to 5. You know, what are disenrollments looking like? You know, what are the trends? What are we seeing over time? And we've kind of gone back pre-COVID because we have gotten some questions about that too. So just trying to think about how enrollment's changing over time. And so, you know, we can see that, you know, between 2024 and 2025, we saw some of our first disenrollments due to the maintenance of eligibility ending that was there during the pandemic. So people kind of kept their eligibility for a long time. And we're starting to see some disenrollments with that going. Also looking at this by percentage of the population. So the folks who are under age 21 and enrolled in OHP, that's about 59% of the population in 2025. And so just tracking disenrollments relative to the population is a little bit helpful. So yeah, these are some of the enrollment visits we have. We also will have a similar like percent of population by age, percent of population by county, and then, you know, other metrics like by CCO, an open card, and we'll also have all the enrollment data by RealD. And so it's all annual, and it's really all based on the CMS denominator for the EPSDT program, which is a little bit different than some of our other dashboards. So trying to just like publish what our denominator is here.
Hey, can I just raise a point here? Maybe go
Yeah.
back 2 slides. You know, I always feel like in a committee like this, it's sort of like, okay, so what do we do with this? I mean, like, what do we do? And one of the biggest issues facing kids on the Oregon Health Plan over the next few years is this, the disenrollment.
Yeah.
I'm anticipating at least, that adults will have a difficult time getting, you know, sort of re-qualified or whatever you call it every 6 months. And that their kids, even though they're still eligible, they won't get enrolled either.
Yeah.
That we're going to start seeing a drop off in kids enrolled in Medicaid. And so, you know, if we want to think about how do we continue to help support access to services, that's something that we can pay attention to, figure out how to get ahead of, and take some action on.
Yeah, I love that. No, that's totally true. I've been also worried about it, but it's like what can we do? But I hadn't yet thought about how that could be a useful analysis, like parents falling off but keeping kids still enrolled. So that may be something to continue to monitor and keep on my list. Yeah, Mark.
I was just going to mention, you know, something for the future. I think population demographics are also going to be working against the chart because we're projecting fewer children in Oregon. We're having fewer kids, but we're losing population in some areas, and so that could also affect the enrollment numbers.
Yes, totally. Yeah. And so that is one reason why I bring in the percent of the population, which is I also have a graph with different age groups. So you can see like the percentage of kids 0 to 5 of the population. So you can see if the percentage of the population is decreasing versus just disenrollments decreasing. Because as you say, we could see disenrollments, but maybe they're correlated very well with the population size. So that is one.
You will, and this is getting at the percentage of the overall population. But if that population group is declining, you're still going to be showing the percentage of the ones that they are. But the point I'm trying to make is that we're just going to have fewer people in Oregon, is what we're projecting in the future.
Yeah.
To put some
Yeah,
downward
yeah.
pressure on it.
Like you mean fewer total humans?
Yes,
Okay.
particularly young individuals.
Bree.
Does this take into account the aging out of the year of the 21? Because like so in 2016 I hit 21, so I would have aged out in 2017 on your map chart. Is that taken into account?
Yeah, so basically it's whether or not anyone was under age 21 during the year. So if you were under age 21 at any point during, let's say, 2024, then you would be included in the count. Okay. I'll
When
keep
you
us
put the report out, could you like specify that? So because otherwise it doesn't make sense.
Sure, yeah, we could definitely add that as a note. And another sort of some more context is that generally when we have like these dashboards or these reports, they sit on a web page that has a lot of information on it. And I can pull one up and show you really quick. So like this dashboard, you kind of land on it and it has like a welcome message. But I think the really important part is what you're getting at is there's all these filters and definitions and more information beneath the dashboard with sort of these technical notes. So I think Natasha will definitely take a note of that. That's great feedback, and we can make sure to add a note to the slide and add it to some of these things below where we have the definitions and such. Okay. Okay, 2:39. I think I'm doing pretty good on time. So next I just want to talk about for the early and periodic screening diagnostic and treatment program, we've been kind of going through their guidance, and a lot of the guidance talks about youth with specialized needs. And we've been trying to think about like how can we support care coordination for these kids with specialized needs. And so we have sort of developed a method to identify children with these specialized needs within the population, and this has definite overlap with folks here. In the blue, we have kids that have complex chronic diagnosis, so they have medical complexity, and that's per the pediatric medical complexity algorithm. OHA had published PMCA data, that medical complexity data in the past, and the grant sort of ran out for that. So we are going to start publishing it again. So we'll have medical complexity data. We have data on anyone under 21 who's had a behavioral health diagnosis. And I am staying connected with Hillary and our Medicaid leadership to make sure that the way we're defining behavioral health is sort of the same as what's in the SOCAC dashboard. So hopefully by the time this gets published in December, like it'll be pretty aligned in numbers wise. I think for our behavioral health diagnosis, it's a little bit higher. Our estimate's a little bit higher than the SOCAC dashboard, and that's because we do a 2-year look back. versus just a 1 year look back. And so there's a little bit more kids with the diagnosis, but yeah, hoping to, dial this in with Cody and Hillary as the report gets finalized. We've identified kids that have a disability, and so we're using both self-report data from RealD, and we're also using administrative data from Medicaid claims and the Medicaid OHP application to sort of get an estimate of disability. So it doesn't just include kids that have like an IDD plan, but it includes more children than just that. So in that way, it differs a little bit from the SOCAC dashboard. I'm trying to identify kids that have a connection to foster care or child welfare, so like any history, and that's based on their eligibility codes. And then kids that have been released from a carceral setting during the year. So this is 2025 data. I think right now I only have data from the Oregon Youth Authority, so I need to label that correctly, but hoping that as time goes on and our reentry effort continues, that I'll have better carceral data and can better identify kids who are releasing, and that way we can track, are they getting care coordination when they're released? Are they, this is related to, the acronym is FCAA, and it stands for Federal Consolidation Appropriations Act, something like that. But basically, it's a federal requirement to help kids transition out of carceral settings when they're released. You may all know about that, and I may be putting my foot in my mouth, but trying to track that and make sure, kids are getting their meds when they're released, things like that. And I have a little bit more information of that here.
That's a very real thing, and it's good that you pointed out. When you are incarcerated, you're not eligible for Medicaid. So when you leave an incarcerated whatever setting, there's lots of gaps, and whatever you think about why someone was there, you're incredibly vulnerable to just falling off a cliff, being homeless, ending up re-incarcerated. So doing these kind of transitional supports makes sense.
Awesome. Yeah. So the reentry efforts were originally part of like our 1115 waiver, but we're continuing with those benefits that are basically related to EPS-DT members who are releasing and like post-adjudicated. So yeah, trying to learn more about that and identify those kids. And so later on, we can say, we can compare outcomes or monitor these youth with specialized needs more closely than the general population. Yeah, Bonnie, I see your hand.
Thank you so much, Paige. My question would be, to help me better understand your chart here, we need to know how much of this is overlapping data. And I see the note that there is overlapping data, but how much is it overlapping?
I love that question because it really leads into the next slide. So I also have this plot. It's a Euler plot, and I don't have the kids with history of child welfare or who have been released from a carceral setting, mostly just from limitations of the chart making software. Like when you put in those really small numbers for those groups, the graph ends up looking really weird. So to sort of look at this overlap or the intersection of specialized health needs of youth, I've been looking at that overlap for complex chronic diagnosis, the behavioral health diagnosis, and then the disability status, and just trying to think like these things really do intersect, and we really want to think about like the kids at the very center, and ideally when this goes public, we'll also have like summary tables and things like that. So even though we don't have those other two groups pictured, we can still view that data, even if the circle plot doesn't work very well. So yeah, just trying to think of how the population overlaps and seeing what we can do in the future, thinking about it this way. Cool. Okay, systems view. This is where SOCAC comes in. So I have 2 slides for the system of care. So on the first slide, I'm really just have a couple sentences about the framework and linking the framework. And I was going through all of your strategic indicators and process measures, and I just wanted to kind of highlight the ones that I felt really had an overlap with the EPSDT benefits. So, the SUD prevalence, specialized home and community-based services, emergency department boarding, suicide attempts, downstream system involvement, interpreter needs, utilization of school-based health services, respite care, and the social emotional intervention. I think that just wanting to highlight, when I looked at all those things, these are all things that we talk about in EPSDT, and just really wanting to highlight that in some way or another we are working related to a lot of these measures, even if the measures are maybe coming from a different program. It's still something that we, if there's any policy issues or operational issues or things like that, EPSDT can maybe be a support or another source of data for measures in the future.
Hey, Paige.
Yeah.
If you could click back one slide.
Sure.
At the top where it says System of Care, SOC's Oregon's framework for supporting youth and families who have complex and significant behavioral mental health needs and/or intellectual and developmental disability. There's also a component of our statutory mandate that is they need to be involved in 2 or more publicly funded child serving systems. I don't know if that's too much information to include, but I want us to not be misleading.
Yeah.
This is for any child with complexities, but that the mandate is specific to multi-system involved.
That's a great call out. I think on my initial slide, I had the government agencies included, and then I was like, is that boring?
I mean, it is, and I'm not sure like how much information, but I don't want to be giving people this, an unreasonable expectation or do you know what I mean? I think accuracy and brevity are both important, so I'm not sure how to kind of hit that mark in between them.
Yeah, I think I maybe like deleted it and didn't realize that I deleted an essential part of the definition. So maybe Cody, we can go back over it and make sure that point's included.
Yeah, Paige, I don't think you get to blame yourself here because I'm pretty sure that was my edit to bring those down for presenting. So you were free of blame. This one's on me.
Nice.
All right, we'll clean it up. All right, sorry to
No problem. Yeah, the good news is we have until October, which we'll have like director review, but like even if something came in like, oh, it's the day before Thanksgiving and there's something wrong, like we can still fix it. So no. But yeah, that's sort of why we're trying to do this engagement early, so that this report doesn't come out and it's, missing something important like that. So yeah, thank you for pointing that out. I appreciate it. Okay, and then the next slide is just basically linking some of the major data products and like what you can get from the data products. So the data report, the strategic plan, and then directly to the dashboard. So again, I'm not sure how this will end up in the final report, but just wanting to make sure like connecting how system of care relates to EPSDT, and then also just like using this opportunity to direct folks over to your materials. I don't know who's going to end up on our report who hasn't seen the SOCAC report yet, but could be a couple people, I don't know. So it'll be linked here. So if people find it, they can find out information about the System of Care Advisory Council. Yeah. Cool. So yeah, I'll sort of talk a little bit about member outcomes, and I'm seeing we're at 2:51, so I'll hurry.
You have about 6 minutes, Paige.
Okay.
for presenting a comment.
Okay, thank you. So, yeah, just wanting to start out the member outcomes with member voices from Ombuds. So, Kate at the Ombuds program sort of compiled some of these like composite stories from EPSDT members. So they're like kind of de-identified if that makes sense, and just kind of sharing what what they've already heard from members, and how they might respond to those experiences. And we're working with Kate to make a more substantial slide with member stories. So we'll have like basically 2 slides with member stories from EPSDT members, highlighting some of the things that they've shared. And then the plan is to then go into behavioral health and talk about some of the highlight some of the work that Hillary's done, and some of the data presentations that Hillary has on related to like, okay, like we see these problems, but what are our solutions? So uplifting the help me with the acronym IIBHT, is it in-home intensive or intensive in-home?
Intensive in-home. Yeah.
Thank you. I always forget which I is first.
I know. It took me about 2 years to get it right, Paige. Don't worry.
Okay. The mobile response services. I think I know that Kate and Hillary and Amanda Braxton, we have like a list of some of the programs that are promising that we want to highlight. So, kind of start with member voices and then highlight some of that behavioral health information and programs that are helpful. And then we're going to really dig into the child core set data. So we'll have, data from CMS on child core set, like how is Oregon doing nationally? And we're thinking about, not simple things, but like child visits, like things that we're already measuring that we really need to we have all this data, let's look at it. And then we're going to use the CCO quality metrics, which are basically the same measures, but they, looking at the gaps between groups. So, as inequities decrease, we'd expect those service gaps to also decrease. And so, for example, lead screening, Oregon isn't doing very well with lead screening. We don't screen enough kids for lead poisoning. And so, Malheur County, 81% of kids are screened. Douglas County, 5% are screened. So there's a 76% gap in screening. So where are those gaps biggest? Can we identify those and name those? And we're going to look at like different measures that we already have from that child core set. That's it. I made it to the end. I appreciate everyone chiming in and giving feedback and discussion. I really appreciate it. And I know you probably need some additional time, Cody, so I can hand it back, and I'm happy to take more questions.
I think we have time for a couple of questions.
Okay, sure.
If we have some. I know we had some discussion during the presentation as well. And so if this turns into something that's very lively, we can figure out a way to discuss it. Otherwise, please send questions to Paige. If you need contact info, I'm happy to help as well. But we do have time for a couple questions.
The only thing that comes to mind for me is more of a comment. And you might not be shocked to hear me say this based on what I've said already, but I feel like there's room in all of these reports like this for recommendations. A lot of times we see analysis, but no recommendation. And that may not be your lane, it may not be, but I feel like when people get gobs of information and it's very interesting, but you get sort of like a paralysis around, okay, well, what do I do? What does that mean? So anyway, recommendations may be
Yeah.
good.
We did have a lively discussion about adding recommendations to the report. Um, some of us kind of feeling like the same way, if we just put all this out there and we don't do any recommendations, are we really serving equity? Are we like, but sort of on the flip side, this is our first report and we're trying to stick with things that we have that are already publicly available. Because really it's like Natasha and I drafting the report and Nick has been a huge support as well. But getting recommendations approved this year, I don't think is feasible, but I think that will definitely be one of our limitations and next steps, like huge limitation. This report doesn't have formal recommendations, but hopefully in subsequent reports we will have those. We are bringing this report to the Children, Youth, and Family Governance Group, which is like all the OHA managers that work on children, youth, and families. So I think we could see some recommendations coming out of that group in years in the future. In terms of this report, we're planning to focus on uplifting EPSDT guidance that we would like to implement in Oregon rather than like formal recommendations from OHA. So we have all this EPSDT guidance documents, state health official letters on the behavioral health toolkit, best practices for data and monitoring. So trying to pull out some of those like best practices and guidance recommendations will be part of our executive summary. And we're trying to focus on like of all the guidance, what things could we implement that will support equity and which of those are a low lift and which of those are a high lift. So we're still thinking about that and yeah, hopefully you will be able to review it in the final report. So, we're kind of going around and doing our presentations. We'll have a final report review before October. And so maybe Cody, we could make sure to follow up on that and think about how we can frame the best practices and guidance in the final draft.
That sounds great.
Cool.
Paige, thanks for being here today. Our post-meeting survey link is in the chat. Let us know how the meeting went today. We do review those and try to improve as best as possible, or keep doing things that are working. Our next meeting is August 11th. I can't believe we're almost in August already, but here we are. And the next couple of meetings, we're going to be discussing measures for our SOCAC strategic plan. A lot of the folks here were either not involved or less involved in the measures process. So we're going to be doing a review and then update on where we're at for measures and discussion. Thank you everyone for coming.
Bye.
Bye.